Good morning, everybody, and welcome to Weekly Wake Up, our opportunity for BVSD employees to connect with district leadership and other people in our community about important topics in the district, for you to be able to answer or ask your questions to us, and for us to talk about cool and important things, talk to our staff about the awesome things that they're doing. And today I'm actually really excited because we've got our health services team here, as well as some representatives from the Boulder County Public Health Department. As I've shared before, Friday afternoons seem to be the time the Colorado Governor Jared Polis makes his big announcements regarding COVID-19, and he did not disappoint last week. He shared some concerns in regards to rising case rates in the state, and then announced that later this week will be evolving from the statewide public health order to local control in those decisions, which among other things means that the statewide COVID-19 dial with its rainbow of colors is going to be going away. Well, sort of. And so we're going to talk about that today. At least here in the Metro Denver area, public health agencies are talking about continuing to keep it going, at least for the next few months. So we're definitely going to talk about that. We'll be diving into that and all that it means for our schools. And then, really the big focus for today is really focusing and celebrating the outstanding work of our health services team. We really are hoping that we can share some of the ways that they have been deeply involved from the beginning of this pandemic in every aspect of what has happened, from ensuring that we're working on prevention to testing folks, and then obviously all the work of trying to quarantine staff and students as people have gotten sick during the pandemic. And then, of course, we're going to discuss some of the basic things that we've been doing since the beginning that really work to try to prevent the spread of the disease. So without further ado, I'm going to go ahead and stop sharing my screen real quick here and introduce our panel of guests, and we'll just have each of them say hello as we're going around the room. We're going to start with our Dr. Chris Urbina from both Broomfield and Boulder County Public Health. Good morning, Chris. How are you doing today?
Good morning, Randy, and it's always great to see you and your team. You guys have done such a tremendous job. Glad to be here.
We love having you guys as partners. And speaking of Boulder County Public Health, I want to introduce Angela. Angela, good morning. How are you?
Hi, good morning. Thank you for having me today. It's great to see everybody. I'm Angela Cimental. I am the Communications Manager for Boulder County Public Health.
Perfect. Thank you for introducing yourself. We're so glad to have you aboard. And I know that we've already been working on a few things, vaccinations, going wild right now. So not wild, it's going well. But a lot's happening is what I meant by that. So, okay. Usually when you say wild, things are bad. So anyhow, I want to keep going around the room. We have Director of Health Services, Stephanie Farron. Good morning, Stephanie.
Good morning, Randy. Good morning, everybody. Nice to see you.
We have some of our amazing school nurse consultants. Christina Hyde, good morning.
Good morning. Thank you for having me today.
Absolutely. And remind us what schools you got, which ones you cover.
I cover Summit, Flatirons, Uni Hill, Whittier, Jamestown, and Gold Hill.
Awesome. Okay, thank you. We also have Kim Kennedy. Good morning.
Good morning. I'm the school nurse at Fairview. Excellent.
And we have your para with you as well, your health room para. Good morning, Hillary. How are you doing today?
I'm great. Thanks for having me, Randy.
Absolutely. We're great to see you today. Alicia is our COVID resource nurse. Good morning.
Hi, good morning, everybody. I'm one of the COVID resource nurses on our COVID response team. Thanks so much for having me here this morning.
And then finally, rounding out the group is Brittany, who is a registered nurse and has been overseeing all of our craziness in terms of our testing. She's all over the district. If you haven't met her already, you soon will, because with the COVID random testing, she is like out everywhere. Right, Brittany?
Good morning. Yeah, I'm Brittany, and we are now in all 57 schools, and you'll either see me or meet one of the 16, 17 people on my team. So we're everywhere in the district now.
It has been amazing. Again, I cannot stress how many things that this team is doing right now, and so we just want to celebrate and highlight that. I also do want to mention, as always, we are going to be taking your questions throughout the time here, and somehow I closed my slides here, so I'm going to try to open it up again so that I have the URL, because it's very important that I actually have that URL. So here we go. All right. everybody see my screen? I think I am presenting. Okay. It's bit.ly, that's bit.ly/BVSD-WakeUp. Again, that's bit.ly/BVSD-WakeUp. If you have a question during the show, we will be taking those today. So thank you for submitting those. I'm going to go ahead and just, kind of jump into some of these questions. Chris, as I mentioned, the governor announced that we'll be transitioning from that big statewide public order to local control in those decisions. What do we expect that will look like for Boulder and Broomfield counties as we start to implement our own public orders this week?
Randy, thanks for asking the question. I think that's what people want to know. And I can assure you that the Denver metro counties have been working very closely together to kind of mirror what everybody is going to do. Tri-County announced next week. So that we're going to try to maintain many of the guidance that was as we go forward. Of course, the important thing is we want to keep our kids and our communities safe. So we're still going to encourage, we're actually still going to require masks indoors. We're going to encourage people outdoors to wear their masks, maintain 6 feet of physical distancing, avoid large social gatherings, washing your hands. The things that we know have been working effectively at reducing the spread of the infection. So I think you're going to still see those guidelines come out this week as the governor statewide order expires this Friday. So you're going to hear all of the counties say, this is what we're going to be doing. And it's likely that we'll have some similar recommendations, maybe starting at a slightly lower level, but just anticipate you'll see a lot of PR, and maybe by the Board of Education meeting tomorrow, we'll have more information. We can share that as we go forward.
And I always appreciate you have such a calm and reassuring voice when you say these things. And, the way I always think about it is that this is not going to be pandemonium. We've gone through changes similar to this before. This will not be cats and dogs living together, although sometimes in some households that works out okay. Again, some of these ideas that we've been working on and talking about from the beginning, really, I know you and I, it's sort of like the ongoing thing here. That the same stuff that we used to do to try to, prevent cold and flu season is really the stuff that works, and it's going to continue to work. And so whether we're talking about, what a classroom looks like, I know that we've gotten some questions and we'll talk about the variants, but, the idea of, essentially we want people to just to keep on treading with the same things that they've been doing and that have been successful up to this point.
Agreed, Randy, and I can't emphasize it enough. I think our team, our school nurse team, our health folks on this call have all encouraged our students and our parents to do the same things. We know it works. We know that face masks do work. We know keeping physical distance in our classrooms. All the things that Boulder Valley School Districts have implemented have been tremendous in reducing the spread within schools. So maintaining cohorts of quarantining when it's necessary, and isolating those kids that have symptoms and testing them, all of those things, ventilation and washing their hands, disinfecting the surfaces, all of those things have really protected our kids in the schools. What we're still concerned about is the extracurricular activities that happen outside of schools. So we're still encouraging people, whether or not they participate in sports or choir or band or whatever it is, still to try to maintain those same protection strategies that we know work, masking. And we'll talk about that a lot. You and I always joke about these layers of protection, and I think that's a quote I think you came up with, not me. In terms of that. And now we have vaccines. So having the teachers and administrators and staff be vaccinated, I think adds a tremendous layer of protection. And as we increase the number of vaccines in our community, that will continue. So that when you get a chance and the vaccine is available, we encourage you to get the vaccine. And then while we're waiting, continue. And I think we'll probably have some form of masking and social distancing in the near future as we see the rise of variants in our community. And we'll talk about that. I know there are going to be lots of questions about it. I'll stop there and we can address that in another question, the rise of the changing virus in our communities.
Yeah, let's go and take a couple of the teacher questions that we got over the weekend. One was from a teacher at Aspen Creek who asked, is it safe to send kids to school while positivity rate is above 5%? She said that she gets an email every, almost daily that there's been a diagnosed case in one of her two kids' secondary schools. What would you want people to know in regards to how that works?
I'm glad you asked that question. I know Stephanie or any of our team could answer this equally as well. You know, obviously, if you've been in contact with somebody who's had an infection, they should stay home and quarantine. And what that means is that we're still recommending 14 days is ideal. 10 days is probably in a very good number to keep in mind. At least stay at home for 10 days if you've been exposed, and then watch your symptoms for 4 days. If you develop any symptoms of COVID-19, then they should get tested. It's as straightforward as that. If you do those things, you can protect your children. Now, I know we still do symptom checking at most of the schools because we don't want kids coming in with those COVID-like symptoms, so we can spread that, potentially spread those infections. So now that we have good testing out there, there's no reason why people can't get their kids tested if they have concerns. So I know our school team health team can answer that question specifically. But in the meantime, all the protection factors that are going on in the schools, the masking, the physical distancing, the cohorting, the ventilation, will actually protect your kids. I think your schools are one of the safest places to be now because of all the things that you've implemented in the schools. It's the extracurricular activities that I'm still concerned about because the kids are still giving each other high fives, hugging, not wearing their mask when they're doing extracurricular activity. I get that. You can reduce the spread of infection if you avoid those things. I really don't think that you'll still continue to score tremendous points if you don't give your buddy a high five. You don't need to give them a high five. And
it's hard to break, right? Like I know I've been in meetings lately where everybody, you just put your hand out. It's just like,
no.
Yeah, I know. You gotta do the elbow or the fist bump, right?
Sure.
So,
I hope that helps, Randy. I think
no,
I'm trying to be very clear about the recommendations. Yes, it is as safe as you can make it. You can help protect your kids and your family. You can get tested. You can get your vaccinations. I mean, all of those things. And as I'm sure there'll be questions about vaccines, when's it coming out for kids, but we can answer that a little bit later as well.
I can't take credit. We do laugh and we talk a lot about the layers of protection, and we really did try to push that hard at the very beginning. I have to credit the folks that came up with the amazing Swiss cheese analogy, because that really kind of blew my mind when it was like, okay, nothing's perfect, but everything adds to the layers of protection. I do want to try to coin my own analogy here, which is lately I've been thinking about testing and the fact that it feels like folks sometimes feel like they can try to avoid that it's going to rain by just not having radar. At a weather station, we used to have Doppler 5000 9-use radar. I can't even remember what it's called, or 9000 or something. Of course, it had to have a 9 in it. But the idea is that you wanted to see what was coming, what was out there in the community, what was going to be happening. And it feels like it's sort of funny that a lot of folks kind of, want to kind of take a blind approach to, if we don't test, it's not there. It really is like the radar, right? Like the rain's coming, it's there. To the positivity rate, it's regarding how large I don't want to call it a storm because that sounds scary, but how large that next wave might be. These are the things that we have to keep aware of. And we know that, when people are sick in the community, it comes more to our schools than not. So, again, having some understanding and we're going to talk to Brittany in a couple minutes here in regards to the testing, but by knowing what's out there, that helps us to really take action. It's better to know versus, sort of trying to shield yourself from it, right?
Yeah, and I think if you know you have an infection, whether or not it's measles or flu or COVID-19, you can take proper precautions. You can stay at home isolate for 10 days, and any people you come in contact with, and the school health team have done a great job of notifying people if they come in contact with somebody who's positive, so they can protect themselves and protect other community members. That's really bread and butter public health. There's my food analogy, bread and butter instead of Swiss cheese. Bread and butter public health work that actually works. But now that we've had so many cases, it's difficult to stay up with them. So Stephanie, if you had anything else to add, I'd be happy to welcome that.
Yeah, thanks, Dr. Urbina. I just wanted to say I do believe that the testing that we have here in BVSD has made it really, like you said, Randy, it's so convenient for anybody in our school community, staff or students to get tested. Any day of the week, you can go and get a test. It's free. It's super simple. We have saliva tests, very reliable. you know, we know, especially now, again, it's springtime, everybody and their brother has got itchy eyes and a little tickle in their nose, all of these typical allergy symptoms. And, you know, I know that every one of the nurses here has heard over and over and over, oh, I didn't have any symptoms. I just had that little congestion. I just had that little tickle in my throat. Or I just had a little headache. It wasn't anything. I can't believe I'm positive. We really stress, again, any symptoms at all, just go and take advantage of the test. Again, it's free. It's really simple. And, you know, unfortunately, we're seeing, you know, COVID in our community, and we want to catch that, like you said, really quickly. We want to use our radar. It's really important for us to know so that we can, you know, we can get out of that rain right before it hits us.
Yeah, I think it's so important that we're able to sort of take action based on what we know that's out there. And I mean, since we're talking about testing, Brittany, why don't you tell us a little bit about, first of all, you guys started with mobile testing, and so we were trying to hit areas. I don't want to put words in your mouth, but we were trying to hit areas that were away from where the county had their locations. And then now, you know, we've really kind of taken that next step to randomize and try to hit as much of the school district as we can, right?
Yeah, so when we first started, it was the schools that the previous semester or fall semester that they were high risk, had a lot of cases, and the ability to get to the other testing sites through Boulder County weren't as readily available to them. So we definitely hit those. There's about 22 schools that we identified as our essentially our hot spots. And we discovered that pretty much all the schools were hot spots as well with this climbing cases that we've had. So we've expanded our testing to all 57 schools. We're in all 3 networks every single day. Every day we're between 10 and 14 sites throughout the school district. So there's lots and lots of availability. People, like Stephanie said, it's still completely free. And we're going to continue to maintain that. So we do our testing Tuesday through Fridays. And we have it so that if parents want their kids to be tested while we're at their school, they can either do that every other week or once a month. We just encourage them to get signed up so we can have a better bird's eye view of what's really going on in our schools and our community, so that Boulder Public Health knows and Jared Polis can know better, and we can make some more educated decisions.
What do we do with that information once it comes in? And also, I just want to, before I forget, this is something that obviously our randomized testing is really focused on the students, but staff, if it's at your building and we're promoting those locations, we encourage you to participate whenever it comes by your building, right?
Yes, please, 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 staff, you can come up anytime you want. You don't have to be. So the students get an email and their parents that you've been selected this week. As far as staff, come up anytime you want. We are more than happy to take care of you. Pop in and out between your classes. It's a very quick process.
And I think it's true too that if it's not, if you might have symptoms, if you are worried about that you could stop by as a staff member. You can stop by another location within the district as well, right? Like you don't have to wait for it to come to your school.
Absolutely. So if you're symptomatic, if you're on quarantine, you can come to any of our sites. Just let the front desk know when you arrive, hey, I'm here because I'm on quarantine, or hey, I have symptoms. Please let the COVID team know that I'm here to be tested, and we'll come out and we'll take care of you.
Stephanie, do you want to add to that?
Thanks, Randy. Yeah, you know, the one thing that I wanted to mention, again, is even though we have most of our staff, probably, you know, the vast majority of our staff are vaccinated and fully vaccinated, that doesn't mean that if you start to develop symptoms, you start to feel a little yucky, you still have to go through the same protocol as before you were vaccinated. So you have that 24, 48-hour window depending on your symptoms, and then we need you to get tested as well. And don't wait, just go and get tested right away. It's again, it's super available. And although the vaccine is really incredible, we do see some breakthrough cases of folks who've been fully vaccinated who are still contracting COVID, and you know, they might not be really sick and they might not even transmit the virus, but we certainly don't want them at school. We want them to be home for that isolation period. So it's important to remember that even if you've been vaccinated, you still need to follow all the same rules around screening and testing and things like that.
Yeah, I think a lot of folks think that when it comes to, you got your vaccination, it's almost like a super suit, right? Like
Right.
you have kind of immunity from, like you got a bubble around yourself. And it really is like that other, going back to the bubble layers of protection that we've been talking about, right, Chris? That it's not foolproof. It's a really great, strong layer of protection, but it's not everything.
Yeah, Stephanie, thanks for mentioning that. I didn't want to be doom and gloom, but I do think that we know the vaccines are highly effective, and I think that's good. But no vaccine is 100%. So I think we have to keep that in mind as we go forward of why we're still recommending masking, physical distancing, social gathering, getting tested, because we until we can eliminate or do the best job as we can of having a combination of natural immunity and herd immunity on vaccines, then vaccinated, we will eventually have no place for the virus to go. And regardless of whether or not it's a variant or a predominant strain, masking, physical distancing, avoiding large gatherings, washing your hands are all protective against the infection. Thank you for mentioning that, Stephanie.
And I know you and I have talked about, to a certain extent, we hope, although, we know that people tend to want to get back to normal and all those kind of things. But, as we look forward into future years, I mean, we do hope that maybe people will take some of these deals, obviously the normal things like washing your hands, but, even if you have a question that, you avoid school when you're sick, or that maybe you wear a face mask during cold season. And these are good preventative measures that really can help us long term.
Yeah, if you remember, Randy, we talked about this, and now that's getting a lot of press. We talked about this 6 months ago. We knew that if we got people to mask and social distancing and do all the things that you guys have done, we would reduce flu rates. Duh, in terms of stopping respiratory infections, all the things that we've done. And I think that continues, and we have a very good vaccine continue on in the future. We can do the same thing we did this year for flu for COVID-19 in the future.
I do want to, I think about the kind of, and again, I'm thinking about all these teachers that are out there, staff members, administrators that are dealing now with folks that, as we get closer to the finish line, we know what this looks like. Everybody's getting tired of living under precautions and wearing masks and that kind of thing. And so they're hearing from folks that are like, face mask or child abuse. That's what we've gotten on our Facebook page, at least, and pushback in regards to wearing it. Can you give them maybe just a little bit of a pep talk of why this is so important, in these finishing days of a pandemic?
Sure, and I think I would also invite any of our team here on the Brady Bunch calendar here. The idea that we can prevent something from happening it should be celebrated. We could say we could do our greatest part by all of us playing a role. Number one, getting vaccinated. Number two, continuing to wear masks when you're not able to keep physical distancing, avoiding large social gatherings, and washing your hands. If we can do that as a community, we can significantly, Boulder could stand out as one of those tremendous counties that has done a great job of preventing COVID in our communities. And BVSD could be the greatest, the best school district in the community by saying we took our responsibility in our hands and we made a difference because we together really made a difference in trying to stop the spread of infection. Is that peppy enough?
I thought that was great. Brittany, did you want to add to it?
So just to go off of Dr. Ubina's comment about being like, here's BVSD, we're the greatest. Our testing program has made it out to Yale University of being the first in the nation to do anything like this. And we're going to be working with COVID Check Colorado and Yale to make a protocol for any future crisis testing programs like this. So just know that our school, even though we've definitely had some trips and fumbles in this, we are doing incredible things, and we are being out on the forefront of getting ahead of this and doing the best we can against COVID-19.
I truly believe that the things that we've learned this time around will serve us great. Alicia, do you want to add to that too?
Yeah, just kind of going back to the comment, where masking is child abuse. I think we've all seen how adaptable our kids are this year, especially that elementary age. I mean, this is just kind of their new normal. I mean, I have elementary age kids. They just grab their mask when they go outside with their friends. This is what they do now. And for them, I think they're okay. It's just not that big of a deal. So I know we'll get back to a different normal someday when we don't have to wear masks. But right now, if that's all it takes to prevent a little bit of spread, it's not so much. And our kids are going to be okay.
I just want to join in on what you're saying there, which is that my kindergartner is the best of wearing the mask out of my entire family. She has no issue with it. It doesn't bother her, whatever. And I also do want to give a gigantic shout out to our teachers, because I've been helping to coach my daughter's soccer team lately, and trying to yell through a mask. Well, and I know teachers aren't yelling, but trying to project, I guess, is maybe the better word. Talk loudly through those masks is a task. And so I do, and I know that we heard that, early on, and how are we going to do this? And you guys have persevered, and, we always want to, thank you for that. I do want to mention to Chris, that we are going to get to this Brady Bunch. I don't want them to think it's too far away, but let me get to a few other pertinent questions real quick on testing. We had a person in transportation ask, will testing sites be available through the summer and after May? Any thoughts on that, Stephanie or Brittany? Have we heard?
I believe right now we are planning, we're hoping to be able to keep at least one, maybe two of the mobile sites up and around, because we do have activities all summer school. We have extended school year programming and camps and things like that go on, as well as athletics all summer long through BVSD. So we're hoping to have those, up and running, one hopefully on each side of the county, east and west.
And of course, I don't know for sure how long any of these things will last, but I do want to mention too that we do have that partnership with COVID Check, and they do the center over at Centaurus. That's going to be continuing for the foreseeable future. I haven't heard of any sort of end date there. And Angela, I don't want to catch you off guard here, but I know that the county also offers testing. Do you guys know how long those things might be going on here?
Yeah, we have two sites that offer free testing, one at Stasio Ball Fields and one at the fairgrounds. They're still running. I haven't heard any plans of phasing that out, so people are welcome to come in and get some free COVID testing, so we encourage that for sure. There's other testing with other providers. You can find them on our webpage, but those are the bigger ones, the free ones. So yeah, we encourage everybody to go there.
And I've got Jeannie from Benefits in my ear, not really, but just almost like a TV thing. She would also be telling us that, that I know that our providers also, offer some of those benefits as well. Broomfield, I know that they do as well. So I want to make sure to note that there's a lot of different options there. I did mention variants, Chris. I do want to just ask a couple of questions that we got on that, and then we will get to our team and their amazingness. One was in regards to hearing a lot about varieties of COVID, varieties of COVID circulating around especially around our younger students that might be more vulnerable than they were in the past. One of the questions, and why don't we start with that? And then the second question that I'll pose to Stephanie is really how might that change any of our protocols? But I'll start with just what are we hearing out there in regards to variants right now?
This is a really big issue in terms of the variants, and I don't want to sugarcoat it at all. But it's not surprising that the virus is changing. This happens to viruses as you have millions of copies of virus, and when somebody gets infected, so that they have changes. And most of the variants or the changes in the genomic structure of these viruses are innocuous. They actually don't cause a problem. But there are a couple variants of concern, and then we have these variants in Boulder County. We have them all over the state. Those are the one that originated in the UK, and that's the B117 that people talk about. There's also the B147, 1429, that's the California variant. And most recently, there's the P1 variant, that's the Brazilian variant. They didn't that's where they first discovered it. It probably happened at multiple places across the world. But these variants are variants of concern because they can be spread more readily. That means that they're more contagious. So many of the rises that you're seeing in Michigan, and likely that some of the rises you see in Colorado, are related probably to the B117 variant. That's very concerning. The second thing is these two variants, the P1 variant as well as the B117 variant, can cause more severe disease. So we're starting to see, and this is interesting from an epidemiologic standpoint, as we get the elderly like myself and other people with chronic medical conditions vaccinated, you're seeing a rise in cases of much younger people who are becoming hospitalized and having more severe illness. We're seeing the hospitalizations now in Boulder County and around the state and being much younger people. So we're scratching our heads thinking, this is a big deal, and so we're watching this very closely. I heard Richard Hurley, who's our state epidemiologist, say the other day that it's likely that the B117 now is the predominant strain in Colorado. So that's worrisome because we know it's more infectious and can cause more severe disease. So we should not let our guard down at all, and all the things that we've been talking about still protect us. The mask covers all the variants. It washing your hands, physical distancing, it doesn't matter, still can protect you. And the vaccines are largely protective against the variants as well. So all the things that we've been talking about are highly effective. So yes, they are more severe. Yes, they are serious. We're likely in the future to have a booster shot to all of us who've gotten the vaccine. That's still yet to be determined. But we're watching this very closely, and I hope that answers your question. Maybe, Stephanie, do you want to talk about any changes that we are making in our schools related to the variants?
I think the most important thing is that we're not making changes in our schools. We have folks vaccinated. We have talk at the state level of the dial kind of devolving and moving away, and restrictions lightening up and things like that. And we are holding very steady at school with masking, with as much distancing as possible, with the same cleaning, that we've been doing. And we know that there's the one thing that's come out of COVID, or that we've all gotten used to, besides Governor Polis's Friday afternoon shocker announcements, is that, COVID, the guidelines, what we know about it changes all the time. Again, we've only been doing this a little over a year now. So there's been news recently that CDC, doesn't believe that surface spread is one of the major risks. Well, we've kind of known that. We've known that this is more of a respiratory thing, but it doesn't mean that we stop cleaning surfaces. It doesn't mean that we stop washing our hands. We really need to just hold on. And Alicia counts down literally the days for us every day, because we're all tired. We're all tired of COVID. We're tired of cleaning and washing and masking and not being able to hug each other and get together and see each other in person. And we're almost there. And I think, like you said, Randy, we just want folks to kind of keep up this incredible pace for a little bit longer, because we're doing an amazing job here in BVSD, where we do not see transmission in our classrooms, even though we've got a lot of kids coming back together. We see more cases. That's because more people are in school, but we're not seeing, again, an increase in rise in transmission. And that's because of all of those layers that we continue to do. So we have variants, we have all kinds of other things happening, restrictions loosening, and we're going to just hold steady. We're going to be able to do this for a few more weeks. More than a few, but we're getting there.
7 more weeks.
Thank you for mentioning that, because I think that was one of the questions that we got. Why haven't things changed? But that's those things that we have in there, regardless of the, and again, remember the CDC was, 6 feet now. It's, the feet don't really matter. It's the idea of, all these different layers. Alicia, did you want to add to there as well? I don't know. I thought maybe I saw you come up for a second.
I was just counting. I was doing what Stephanie said, just counting down. We can do this. We can do this.
I also just want to honor something that one of the people that put in a question about this, said, and they said, I know that I'm vaccinated, but it doesn't mean that my personal children, the kids in my class, or my spouse are vaccinated yet. Yes, I mean, that is absolutely something that we understand, and that's why we take the precautions that we do. We know that this isn't over, and so yes.
My children aren't vaccinated. My partner is not fully vaccinated yet. I think I'm just hitting my 2 weeks post-vaccine, my second dose right now. We still need to be really careful. There's a lot of folks out there. Boulder County has done an incredible job. Colorado's done an amazing job with vaccines, but it's a small part of our entire population. And we often feel, I think, in health services, like we are sort of the doom and gloom, like Dr. Urbina said, and we want folks to be really happy and excited about what we've done so far, and we just need you to just hold on a little bit longer.
Well, I do want to, switch gears. We've been talking about sort of the protective measures that we have. I mentioned a super suit. Okay, so vaccine doesn't give you a super suit, but what I'm pretty sure of is that these health services people wear some sort of like Supergirl, Superman kind of apparel underneath their normal day wear, because they are amazing. And I do want to just show, if you haven't seen it yet, I'm going to just share my screen real quick here. We recently did a video. Whoops, wrong one. It starts with a copy machine, but don't let that make you think that it's not about health services. Hang on one second. I'm just going to show a little piece of this.
Hi, I'm Susan Brown from the Eldorado K-8 Health Room. I'm the health room paraeducator.
Hi, Bernadette. My name's Linda Patterson. I'm the district nurse for Superior. They've always been heroes to me.
I print off a list every day, every morning. Okay, the list will show me which parents have not completed that COVID screening for their child. They've forgotten, or that they're having computer problems.
The idea of team and it takes a village is paramount.
We need to know if kids are healthy when they're coming into our building every day. Can I see Thomas for a minute? Yep. Awesome. I do get my steps in. I've got my trusty Fitbit going, and I do get thousands of steps in a day as I'm going around the building.
Just following up, see how he's doing.
Kids who are sick need to stay home and rest. And if they don't feel better, they need to go and have a COVID test done.
Sort of, Rose. This is disgusting. I'm a registered nurse working with the COVID team. Like spit like 15 times. It's the only time parents give them and teachers give permission to spit in food and not get in trouble. We were the first in Colorado and the first out of at least 7 states that I'm aware of that to do mobile testing sites in the schools where we rotate locations every single day. Just done.
I think you're all done.
The data that we collect helps families and as well as the school district and government be able to make more accurate decisions of what's really going on in our state and our county.
Working with children, no matter what's going on, they can find joy and happiness and excitement and hope in everything.
Easy.
My name is Alicia Sievers. Do you guys want to run through any other cases from today? So I was hired on as the Medicaid resource nurse, but when COVID hit, I was asked if I wanted to work on the COVID team, and I said yes. And here we are. I think you've had your hand up for a while. So we're really helping our schools navigate cases related to COVID. It can be challenging. It's like a big riddle. Who are the close contacts of that individual?
And I'm going to stop it right there because it is an amazing piece. You need to watch the whole thing. But I felt like that was a good transition point, Stephanie, to say this team, I mean, when you watch that frenetic energy of them going around schools, making sure that we're tracing, contact tracing students, I mean, it's been a whole team effort, and it's been from prevention all the way to, kind of explain all the different places that it hit.
It has been an incredible feat that this team has taken on. And I can tell you, as much as the teachers probably despise that daily health screening and parents do, I know I'm like, oh my gosh, I almost forgot to do it again, and I've got to get out there and do it right away. And you think about, 20,000, 25,000 kids doing that health screener every day, our staff really does look through that. They follow that. They know who's been out. They know who's been out for 2 days versus 1 day. They know what kind of symptoms they're experiencing. That's something that's not being done at any other school district that I know of. And we see the case rates and the quarantines and things happening in other school districts because they don't have that same kind of knowledge of what's happening. It's a lot of work. And like you said, Randy, it's prevention. It's making sure that people understand what's needed, following up with them every day, getting them into testing, following up through the COVID team. If somebody's out too long, it's just an amazing system that really we've built. You know, what's the analogy? As the plane is flying, we're kind of building the plane. It's been incredible. And it's the nurses and the health room staff who have taken all of that and done it every single day through this. And they are incredible. And I just feel so honored to work with all of them.
So let's talk to Hillary. We saw a little bit from, that was a K-8 facility where they were running around in the classrooms. I think it looks a little bit different at Fairview. But you guys are doing similar work of trying to make sure that those kids are checked in and, you know, temperature checked, and if needed, you know, pulled aside, you know, and sent home, right?
Yeah, every morning we've got 4 different doors that students are coming in. We've got 300 to 350 students at each door, and a team of 5 that's made up of support staff, the counselors, and administration that's all working at these doors to get these kids in. And we've gotten better every single day. The first day that we did it just felt like a disaster. So I think one of the really cool things, though, is that we have the counselors that coincide with the alphabet that's coming in the door. And they're the ones, at least at my door, that are checking the students in. And so the students get to see their counselor every morning, which is really cool. And the counselors, their facial recognition now of these students is just, you know, spot on, and they've got their names down. And so the process is pretty quick. Of course, Infinite Campus likes to crash on us at about 8:25. So then we're, you know, struggling, you know, if the parents didn't do the health screen before 7:45 when we pull the reports or whatever, then they're not making it on the list. And so we've got to do it. But, you know, the students are great. They're patient with us. We've got other students in the building that are through Sources of Strength and National Honor Society and Student Council. They're playing music, dancing, welcoming these students into the building, handing them out candy and, you know, beads and, you know, kind words and just positivity. So everyone's just working together to be really, you know, compassionate, understanding, positive. We're just going to get through these next 7 weeks and make it the best that we can.
Yeah, I know that, you know, when it comes to like principals, I think it's been a little bit of a headache. And, you know, obviously we're like, okay, just a few more weeks and, you know, who knows what it will look like next year. But, you know, again, they've been doing this amazing, you guys have all been doing this amazing work of trying to make sure the kids are checked in. You guys are also the ones that if a kid during the day starts to have symptoms, you know, kind of like Stephanie was saying, it might be allergies, but may not be. You guys kind of get geared up and check them out to make sure that, you know, again, you're kind of protecting the rest of the school population at that point, and then, you know, kind of getting the process started if needed.
Yeah, definitely. I mean, I can't imagine really being at an elementary school. I mean, I did kind of fill in the beginning of all of this at Meadowlark and stuff. You know, I think it'd be hard because our high schoolers can voice they know how they feel. And they're not going to come to school, you know, feeling, you know, sick. The students that we see that do become ill at school, it's not really with COVID. It's something known, like a migraine, or yeah, I ate a bunch of spicy nuts and now my stomach hurts, you know, or, you know, it's, you know, things like that. It's not our, the younger children where you're really trying to figure out, the parents sometimes don't know first thing in the morning that their child doesn't feel well. And our high schoolers, at least, they are pretty in tune with how they feel, and they can express that, and they can also leave easily. So, yeah.
Well, I know your partner in crime, so to speak, is Kim.
Yeah.
So she's doing that work. How does that, and again, partnership is key in all these things. What does this look like from a nurse consultant point of view?
Well, I mean, the first thing I have to say about that is we are so grateful for Stephanie, because Stephanie's background is public health. I mean, I don't know how we got so lucky, because this was out of our wheelhouse, so to speak, of what we normally do. And she has led us through this and stayed calm and had a sense of humor when we needed it to keep us pick us up. We love you, Stephanie, and we are so grateful. And I have to just say one other thing is that our school district hasn't lost a single nurse. No, we haven't. Nurses are quitting because this is hard work right now. No one is. We have people knocking on the door wanting to come to our BVSD and work with our team. So thank you for Stephanie and Hillary. Hillary and I are a team for sure at my school. And I think it's communication is a huge thing. Communication between us. I mean, we've got Google documents that we're all sharing and looking at the same information so we can, all understand what's happening, but also communicating with the parents. And the parents, I mean, this affects the whole family, whether it's a quarantine. I mean, we're often seeing a parent is positive for COVID, and then it affects the whole family, and just educating and understanding how, no, you can't test out of it with a negative test. This is what a quarantine looks like. This is what isolation looks like. But doing that with compassion, because it's tough. It is tough. And I went through it with my own family, and I can relate. It is not easy. And, having things like online, having the online school so they don't fall behind in school by these if they have to be out because they have COVID or they're quarantined, they can stay logged on, keep up with their classes. I mean, trying to find the high points in it, if you will, to kind of help them get through it, I think is really, really important. And I guess that's what I can say about that. Thanks.
And I do want to just mention that you couldn't see this because we could only see the person that's talking, but I'm just going to share my screen real quick. When she was mentioning Stephanie, the look was everybody doing the hearts to it's now kind of like a crazy thing on my screen. But anyway, the point is everybody was like, oh my goodness, Stephanie. And I do want to just mention before we go on with all the work of the nurse consultants that throughout this whole picture, and I mean this, like every last detail of this, Stephanie has been there, and in a communication role, it's been huge because so often it's okay, we're going to be saying this about masking, and also our legal counsel has been amazing as well. I want to give a shout out to Kathleen Sullivan too, because a lot of these things come down to what does the public health order exactly say? And Trina with the county, and I mean, just this has been a teamwork. But again, every last detail, whether you're talking about graduation and what that looks like, or a classroom and the way that seats are spaced, it ties back into our health services team, right, Stephanie? And I mean, you guys have been part of that planning from pre-day one. I mean, you and I were, as I've mentioned in this show before, you and I were talking, and I was sort of in disbelief that we even jumped the ocean. You're like, we got to start planning for this thing now. It's coming.
Yeah, well, and it has been all of these team members, because when food services started delivering food in the summer and in the springtime, when we first went to remote, Christina and a whole bunch of nurses got together with them and trained them how to use all of the masks and the face shields and how to glove and how to do all of that food delivery safely. Same thing when the Chromebooks came out. Every one of these school nurses has really been the guiding light for their school through all of those recommendations, all of those requirements. I said it in the little video. I don't think you're going to meet a principal who's going to feel that they can do it without a school nurse anymore. And to what Kimberly said as well, this is not a school nurse's normal job. They have a whole nother job that is incredibly complex and overwhelming. And on top of that they've had to do pandemic. It's an amazing, amazing group of people. And I never could have done this without all of them, without every single one, from our support staff, all of our nurses, Carrie, Lee, our health services coordinator. I'm the luckiest person in the world.
We need to have the movie scroll of all the amazing folks who've been part of this. Christina, I do want to go to you and just talk about, again, this is something that was, sort of unforeseen. Certainly something that we will remember and probably tell our grandchildren about. What has it been like from your point of view?
It has really been I've been a nurse for 20 plus years, and this has been a historic experience for any nurse, I think, providing care throughout this pandemic to our patients and communities. So I have learned a lot in this past year about myself and what I'm capable of taking on, and then also how how strong our community is.
As we were kind of talking about before, when a student is either tested positive or probable, or again has symptoms in the health room or whatever, that kind of sparks a little bit of a chain reaction in regards to kind of the next steps. You guys are working together, you and your health para, and then what kind of happens from there? And then I'm going to pull Alicia into this conversation too in regards to.
So I really appreciate through this whole presentation how you've referred to us as school nurse consultants, because so much of our role this year has been providing that consultation to families and staff around all of the COVID protocols. And, we typically are the first people that get activated when a concern arises in our schools. And so from there, we provide that education, and then we do that illness investigation and follow up with the families. Like Kim says, we look at tons of spreadsheets, and we're cross-referencing, what's in BizLab with what's in attendance, making those phone calls to families, gathering health history. And then based on that information, we provide return guidance and offer testing resources and support to our families, and as appropriate, initiate referrals to our COVID team from there for potential quarantines.
And I do want to mention that, obviously, again, we've got a lot of educators that are watching this, that that partnership between teacher and, and the school nurse consultant is really important, and the health room paras, of course, because, they know their students, they know their families well. And so oftentimes they'll be the first one to field that call or that question, right? But again, you want to make sure that they know that you guys are there to support them and answer. You guys have always been that trusted source, and so you're there, you're raising your hand, send them my way, right?
Exactly. We definitely, like Hillary was saying, with the counselors and the students, making those connections this year. I feel that in all of my buildings, with all of the staff and teachers who maybe only got to see me at the beginning of the year, demonstrating EpiPens, and now I'm on speed dial for all those folks. And it's wonderful because that partnership allows us to be responsive and available to our families. The teachers, yes, get a lot of the illness-related absence information from parents. And when they can funnel that directly to the front office staff and to the health room paras and myself, that just gets us that allows us to respond in a much more timely fashion.
Perfect. Alicia, I know that you obviously at the district level are then kind of doing a lot of this coordination and we saw you kind of on a call. It seems like your day is mostly filled up with calls with different folks. You're circling up with our public health folks. You're circling up with our teams. Kind of talk about kind of what the process looks like from your vantage point.
Thanks, Randy. Yeah, it's a bit of a whirlwind on many days. Essentially, once, for example, Christina was saying, once things are elevated to the COVID response team, things can move really quickly, and a lot of wheels get set into motion immediately. So one of the first things that we're going to do when we get a case that's submitted to us is we're going to see if that individual who's infectious was on site during their infectious period. And if they were, then we're really looking at which groups were they involved with? Obviously the classes, but we're also looking at childcare, if they take the bus, if they're involved with sports, any interventions at school, any after school activities. And then, in a more complicated quarantine situation, we're like notifying all of these separate groups so that they can start identifying close contacts. And so within each of these groups, we're looking at, were they indoors, outdoors? Were they spaced? Were they wearing masks? What was the length of time together? And then for staff, fortunately, now that many of our staff are vaccinated, we have a lot less staff that are needing to quarantine. That is the one benefit of being fully vaccinated. We talked about the symptoms earlier, that if a fully vaccinated staff member has symptoms, we still have to follow our same protocols. But if they have a COVID exposure and they're fully vaccinated, they don't need to quarantine. So that's a nice benefit.
And it's the same with the students too, right?
Yeah, so for our older students, we are seeing some of them being fully vaccinated, so they as well could be exempt from a quarantine. And then also within these groups of close contacts, if an individual had COVID within the last 90 days, then they may be able to be exempt from quarantine. So once we identify who the close contacts are, we're working with our support staff within our team to get notifications together. We are coordinating with school staff, with transportation to get those notifications out. We're providing return dates for everybody. And I will say, just as Stephanie said, the analogy about building the plane as we fly it, in the beginning, it was a little rough, but I think our schools now, it's a smooth sailing process. We have got this down. We know what we're doing. They move quickly, but they move efficiently and they move smoothly. I will say the last part of that process, once notifications go out, is our team is helping to answer questions from staff and families that come up after the quarantine notifications go out. Naturally, there are a lot of questions from the community, so we try to help principals answer those questions as best we can.
Perfect. And speaking of questions, we did get a few more from staff that I do want to bring up real quick. But Chris, before I do that, did you have something you wanted to add to that?
I just wanted to lend my kudos to this team as well. I think that our team, Sabrina, Soda, Heather previously, and now Taylor, have really enjoyed working with all of you. They believe that you guys have been tremendously responsive, and it's been a great effort. And they're not here, but I wanted to just say on behalf of them how much we appreciate all the hard work that you've done and continue to do.
And I will say that is reciprocal. I know that oftentimes that, I was talking about that idea of Stephanie and her team being there to answer our questions. And so often it's with arms, linked with the public health folks in talking about these, crazy, if we do that, then it looks like that, these connective, questions and how do you put into play in a classroom these big ideas of layers and health guidelines and all that kind of stuff. So again, just thank you, Chris, to teams from both of your health departments for sure. Let me get to those questions real quick. One question that we got was, what type of safety equipment do vaccinated pairs need to wear now that they, let's see, where to not be quarantined if one of the classes that they assist goes into quarantine? Right now, they're double masking, wearing safety glasses and face shields. I know that we have just recently put out information that they no longer have to wear KN95 masks. Stephanie, what else would we want them to know?
That's right. If they are 2 weeks past their second vaccine or past their Johnson & Johnson vaccine, then all they need to do is to wear a cloth mask, just one cloth mask, and wash their hands and keep as distanced as possible.
Obviously, every safety precaution you can take will keep you safer. It's again like the switch keys thing. If you feel more comfortable wearing them, there's no harm to that for sure. I do want to mention just on an aside that we really do need teachers and schools' help in regards to seating charts and that kind of thing. Anybody willing to kind of talk about how important that is when it comes to actually close contact tracing and keeping kids from going into quarantine? Yeah, Kim.
I was just going to mention that really quick because in the secondary, it is really important for targeted quarantines. Our goal is to not take out a whole class, to take out as few people as possible. So that information is critical. And I mean, I can't tell you how many times it literally comes down to the seating chart, to kind of walking the class, really seeing where do these kids work together as a group for how long, and so on. So anyway, I know it's inconvenient to have to submit those, but we really appreciate that. It's super helpful. And a lot of these decisions are made after hours. And so we've got to have access to that information when those decisions are made about who's going out.
Alicia, Alicia, did you want to add on to that?
Yeah, Kimberly, I think captured most of what I wanted to say, but I just want to emphasize, quarantines are really disruptive to families, especially working families with young children. So just going back to the importance of having those seating charts, especially on the bus. The bus is huge, to have those seating charts available, to know who's on the bus, when they get on each day. Generally speaking, we do have to do the enhanced contact tracing at the elementary level, which is when we need to quarantine the whole cohort. Unfortunately, just developmentally, it may not be appropriate to have them stay in assigned seats for the entire day. But at the secondary level, it is appropriate. So please do your seating charts. Let's keep our cohorts stable. Let's minimize the amount of people that need to go into quarantine, because truly, it is disruptive, and we want to minimize those disruptions to families.
I do have one more question, and then I'm going to give everybody an opportunity, and we're going to honor those that have to go too, because I know we're at 8 o'clock right now. But I think this might be for Chris and Stephanie in regards to my kindergarten teammates would like to organize an end of the year We Did It celebration. We can certainly sympathize with that. I think we all want to have a big celebration at the end of this year. Could we safely sing a song outdoors? Could we invite family members? The person said that there's about 70 people in their kindergarten class, and they thanked us for any guidance that we could provide.
I would encourage people to celebrate. There's no question that the end of the year is an important time, but I think you could do it safely. I think wearing a mask, physical distancing, washing your hands, and doing it outside are all good things that you can do. I know that I probably look better in a mask, and I think probably some kids sing better with a mask. So I would suggest you continue to do all of those recommendations that we're doing, recommending, and if you can do that, I think you will minimize risk. Stephanie, I don't know if you have anything else to add.
She's shaking her head no. I do know that recently we did put out some reminder guidance in regards to indoor meetings. We're really still asking that folks not do that for now. We do know that this is a wacky world in which, pretty soon, again, the dial is going to go out the window, and we don't know what the next step is, and how long it will take. But, there may be changes to indoor-outdoor guidance too, and we'll obviously be continuing to reflect that and to share that out as well. Stephanie, anything else to add on that?
No, I think if you're unsure, ask your nurse, ask your health room staff. If they don't know the answer, they'll come to us, and we're updating them constantly with everything we know as soon as we know it. Just always go back to them for anything. These are amazing, amazing people, really highly educated and very dedicated folks who know not just COVID, but all kinds of other health-related things, health education, social-emotional health. Go to your school nurse and your health room para.
And I know that our school nurse consultants and health room paras are going to be working on vaccination information for students. They're going to be collecting that as well, right?
Mm-hmm. Yep. Okay. If you have a student that is getting their COVID vaccine, make sure that they turn that information into the nurse or the health office, and we'll get that uploaded for them, just like all the rest of their immunization data.
Again, I do want to recognize that it's 8:03, so if anybody has to jump off the call, Chris, thank you so much for your time. I do want to give a chance for if anybody else has anything that they want to add, last-minute notes to our educators and our staff, whatever you'd like to say, go round robin. I'll start with Kim Kennedy. Anything that you want to add there?
Not really, other than if you are notified about someone who's, and Fairview's doing a great job of this, if you're notified of someone who's positive, just send that information on to us, and we can, figure out the, things that, like the symptoms and the data, the symptoms and testing and all that, and quickly get to, what we need to do going forward. So thanks for everything everyone's doing in the team effort.
Awesome. Thank you. Hillary, do you want to go next?
Yeah, I just want to thank all of our teachers and everybody for just working with these students and being empathetic and compassionate and just helping our students get through this. Is today the vaccination clinic for seniors through Broomfield?
I think that they had one on Saturday. But that is a good mention that we are seeing more and more of these opportunities open up. The health department in Broomfield actually reached out. I think it was Thornton Fire. Somebody was offering some vaccinations, and they were targeting seniors in high school. So we certainly are helping to support that for sure.
Just encouraging all of our seniors to go and get that. They've got so many different events coming up now, and it would feel horrible to have to quarantine any of our seniors at this point to miss any of those. So but thanks everyone. Thanks, Randy.
Amen to that, for sure. If we can get them protected and able to enjoy the prom and graduation, we definitely want that. Christina.
I just want to say thank you again for having us today. And teachers, please seek us out if there is anything we can do to continue to support you. Thanks.
Perfect. Thank you. Brittany.
So as we continue the last couple of weeks, if you can encourage your families, your staff, you're the last 100 on here, so you're the 0.5% of our district, encourage all the testing we can to get that really strong and finish out strong so we can catch any of those quarantines long before they have to interrupt any of our senior events, so we can finish out the year, not interrupt any vacation plans and our lives. So let's get this testing done and get as many people registered. Love to see you guys there.
Awesome. And again, radar is super important. The better we understand what's going on out there, the more we can take precautions and take care of kids. So thank you for mentioning that, Brittany. Alicia.
I think I just wanted to say thank you to all of our staff district-wide. This has just been an incredible undertaking. And even if your piece of this is just simply doing your daily screener, wearing your mask, district-wide, everybody has done their part to make it through this school year. So I just have tremendous love and gratitude just district-wide for everybody. So thanks for having us here today, Randy.
Thank you. Stephanie.
Yep, I echo what everybody else has said. We could not have done this without all of the staff, teachers, our custodians, our paras, everybody doing their part. I also want to remind everyone, when this pandemic is over, and it will be over at some point, you will still have all of these incredible health staff in your buildings. That we have mentioned over and over internally has been, one of the silver linings of this pandemic is just the relationship building that our department has been able to do with principals and teachers and our community. And we really hope that doesn't go away, that we maintain that level of involvement, and we're here for you. Healthy students are better learners, and thank you all so much. And 7 more weeks, right, Alicia?
7 more weeks. Let's finish it strong. I do want to thank the panel for joining us today. Great insights, and really most importantly, what I loved about this too is so many great observations and things that we hope will continue in the future. I mean, the connections between counselors at the doorway. I thought that was amazing. The importance of our health professionals here and what they do for students on a normal basis, supporting them in their learning. Let's not forget about that as we go forward. And thank you all for tuning in, and thank you for what you do for the Boulder Valley School District. Have a great day.